Hi class, and welcome to the module on observational research designs. Your book does a really nice job, I think, of laying out the different research approaches and designs and highlighting the strengths and weaknesses of each of those and the ways in which we differentially use all of those designs to create different kinds of evidence or different qualities of evidence. Your book talks a little in this chapter about the distinctions between qualitative and quantitative research. I think I said in one of my early lectures that I'm very much a pragmatist when it comes to deciding between qualitative and quantitative. I think both are great and both are appropriate for different kinds of questions and scenarios. We'll talk a lot more about qualitative research and mixed methods research later in the semester. Largely within quantitative designs, we'll talk about observational research versus experimental versus quasi-experimental. And so in this lecture, we'll focus on the observational research designs. And as your book notes, and as I'll probably say over and over again, your research design is largely determined by your research purpose. And as your book highlights the stage of the research that you're at, if something is exploratory or in a more confirmatory stage, sort of what the purpose and the question of the research are. So that should be at the base of all of your decisions about the design, about sampling, about measurement, etc. But we'll start here with the design component. And so your book distinguishes between exploratory versus conclusive research and causal versus descriptive research. And so we'll use that language as we move through and talk a little bit about how those different types of research often require different types of designs. And that design really influences the kind of evidence that we produce and the conclusions that we can make, what we can say about the findings of our research. Obviously, we're also influenced by practical and ethical considerations. We can only pay for so much and buy certain kinds of equipment and do certain kinds of procedures practically in terms of financial considerations and space and time. And then we talked in Module 3 about all of the ethical considerations that we have to think about. And so those are very much in the room when we're talking about the design that we're choosing. So we'll talk first about cross-sectional design. I think your book does a really nice layout of each of these designs in turn, and I'll focus on a few of them in particular. Cross-sectional design is a design you'll probably see most commonly in a huge chunk of sexuality research, in psychology research, social work research. And cross-sectional indicates that data are collected at one point in time. You fill out a survey, you do an interview, you do a clinical assessment or intake, and that's the only point in time in which you ask the participant to give you any data, in which they fill out a survey or do anything. Cross-sectional designs are really useful for descriptive purposes. They can also allow you to investigate group differences, relationships among variables, and we'll talk a little bit about correlation versus causation in just a second. Research questions that you could answer using cross-sectional designs are, is there an association between sexual satisfaction and relationship satisfaction? And you could look at the relationship among those variables. Is self-esteem associated with contraceptive self-efficacy? Again, that's looking at the association or the relationship between two variables. Are there gender differences in contraceptive practices? So that would be looking at group differences. And then something more descriptive that we could ask is, what is the prevalence of prescription drug misuse among socially active young adults in New York City? And that's a question that I have asked before. If you're dying to know the answer, that's the reference for that if you want to go and look at that. I like that this chapter in the book, I think it's this chapter, does a nice little overview of the distinction between prevalence and incidence. So be sure that's something that you are aware of and able to think about the distinction between. And as your book notes, as you'll hear me say over and over, every design, every research decision that you make has its pros and cons, has its advantages and disadvantages. And your book, I'll refer you to each of these tables for each of the designs that we'll cover. Your book does a nice job of laying out both the advantages and the disadvantages for each of these designs. So be sure to take a look at those and think a little bit about what those advantages and disadvantages are. And when we're making research decisions, we're often trying to think about what's a disadvantage that I can live with that won't impact my conclusions that I can make so much that I can't make those conclusions anymore, or that I lose so much that it negates the whole purpose of the research. And then thinking about which advantages are really key and critical to being able to do the research that you want to do according to your purpose and your questions. So you've probably heard this a whole lot before. Correlation does not equal causation. And when we talk about correlation, some people say association rather than correlation. So if you think back to the questions that I asked at in the last slide about relationship satisfaction and sexual satisfaction, and we think about what is the association or what is the correlation between those variables. Correlation allows us to see if variables are moving in the same direction. And we talk about correlations as either negative correlations or positive correlations. Typically, when you see a correlation value, those will range from -1 to +1, and the closer they are to 1 on either end, the stronger the association is, so the more similarity that they share in how they move. So correlations allow us to see if two variables move in the same direction. And a negative correlation would indicate that as one variable increases, let's say relationship satisfaction increases, so I have a score of 10, somebody else has a score of 12, somebody else has a score of 22. So across all of those people, as that score increases, we would say that there is another variable that decreases. And with positive correlation, we think that we know that as one variable increases, the other one also increases. So relationship and satisfaction and sexual satisfaction are ones that we probably would predict have a positive correlation. As one increases, so does the other. What we don't know from that association is which causes which. And those two variables are a really great example of two variables that are challenging to tease apart in any way, to say which comes first or which is having the stronger influence on the other. They're very much probably tied up with one another. There are other variables that we can think of as being more conceptually distinct or happening in time very differently. But correlation only tells us about the association or how those variables move together. It doesn't tell us why, and it doesn't tell us that one causes the other. An example of a negative correlation that has the same issue with it is that what we find often in alcohol research is just overall, the more somebody reports drinking, so the more frequently they report drinking, let's say in a month window, the less frequently they report using condoms in sexual situations. There's a lot of alcohol research is one of my areas of research, and there's a lot of research into why that is, if alcohol has some impact on behavior, which may be part of it. But for those studies that we often call global studies, just looking at overall levels of drinking and overall levels of sexual risk, those global studies, we think that some of the reason we see those associations is because we're finding we're seeing a third variable effect in here. So for example, sensation seeking. Those who are high in sensation seeking may also be folks who drink more frequently and have sex without a condom more frequently. So that's a good example of not concluding that there is causation just because of a correlation. But correlations do help us make predictions. And when we get to some of the data analysis piece, I'll talk a little bit about regression. I know those words all sound really foreign, so don't stress too much about them yet. or at all, actually. So we'll talk a little bit more about how we take what we know about correlations and think about using that information to make predictions about the world. So another design is a successive independent samples design. So some people call this a trend study. This is very similar to cross-sectional studies, but these are conducted over a period of time. So a cross-sectional survey, and then again in 4 years, that same cross-sectional survey with a different group of people, and then again in 4 years. So the General Social Survey is a great example of this, and I've used this data quite a bit recently to examine some trends over time. The Youth Risk Behavior Surveillance Survey is another one, and there are a whole host of research questions that we could answer using this kind of a design. One is, how has HIV incidence, and again the distinction between incidence and prevalence, changed over the years among men who have sex with men? How has engagement in same-sex sexual behavior changed over the years? If you're dying to know the answer to that one, I've published a study with some colleagues on this one. Spoiler alert, it's increased. So there are a variety of questions that we can answer using this kind of a design that tell us really interesting things, to me, about how we have changed over time as a society. Again, there are advantages and disadvantages to all of these methods, so you can check those out in table 4.3. And then longitudinal designs, which are sometimes also called trend studies, or cohort studies, or prospective or panel studies. The National Longitudinal Study of Adolescent to Adult Health, which you'll often hear referred to as AdHealth, is an example of a cohort study. And this is a situation in which the same participants are interviewed or surveyed multiple times over the course of some time period. So for AdHealth, they started interviewing these folks when they were in grade school, junior high, high school, and now they're following them well into adulthood. And so we're being able to look at the same people over the course of time, whereas in the last design that I described, we're looking at a snapshot of people over and over. So a snapshot in 2004, a snapshot in 2008, and they're not the same people. But in longitudinal studies, we follow those same people, and we can again document changes over time, and we can document the ordering of variables. So we can find out in a person's life or in people's lives which things come first. And so there, again, are a variety of research questions we could answer using longitudinal research. So one is, how does sexual risk behavior in young adulthood differ between those who received abstinence-based versus comprehensive sexuality education in adolescence? That's also something we could answer using a cross-sectional design, but this might be a situation in which we could follow kids who are getting that particular program and then follow them over time to see how the behavior is different, or how the behavioral patterns or trajectories are different for the kids in different kinds of programs. Does adolescent alcohol use predict adult sexual risk behavior? And I've actually done some research with a colleague on this using AdHealth data that my colleague analyzed. So if you're, again, dying to know the answer to that. And again, advantages and disadvantages to this design. One of the, I would say, probably most important disadvantages that often discourages people from using this design is time. Typically, if you have a question and you want to know the answer to it, it's difficult to say, I'm going to study people over the course of 10 years. And then in 12 years, I'll publish that paper that has the answer to this question that I have. So that can be a challenge to conducting longitudinal research, particularly for graduate students. But it can also be really important, especially in intervention or program evaluation kinds of work, where we want to look at the effects of an intervention or a curriculum or a therapy. And we want to look at those effects immediately, but we also want to see if those effects last. And so longitudinal research may be the best way that we can provide really solid evidence about the effects of whatever that is that we're testing. So your book talks about a variety of other designs. I'm not going to spend a ton of time talking about each of these, though definitely read through all of them and look at the advantages and disadvantages. I think the figures that they show are nice little illustrations of these things. So you have cohort sequential designs, which are a combination of cross-sectional and longitudinal designs. You have case control designs, where you are comparing cases, who are usually those with some sort of a disease or outcome, to people without that disease or outcome. Typically it's a cross-sectional design, a single assessment of some retrospective account of their lives and their experience of risk factors, things like this. And you can look at table 4.6 for this. I think your book mentions the use of this design in London during some of the initial cholera epidemics. And they used this design to try and figure out what was causing this disease. And so they were comparing people who had it with people who didn't to try and figure out what was different about them and about their lives and their daily activities. And then a case crossover design is a situation in which cases can serve as their own controls. And your book talks about that a little bit more. That does tend to be a very psychological and public health type of design. There's lots of advantages and disadvantages, obviously. One of the advantages of this design is that you can have fewer people. If you think about, for example, experimental designs in which you have people who are in your control group and your experimental group, these case crossover designs allow those to be the same people. And your book gives a nice little diagram of that. Across all of these designs, surveys are a really primary way in which we think about data collection. Surveys are often incredibly inexpensive. They're often quick to create, to administer, to analyze. They have a lot of potential for either confidentiality or anonymity, both in how you distribute them and then how that data comes back to you. You can often obtain large samples fairly quickly, which is a huge advantage. And you can often cover a range of topics fairly easily and quickly. I will say on this one, do as I say and not as I do. I am the worst at trying to throw everything into a survey because I'm so curious and I must know the answer, and my participants then end up hating me and not wanting to complete the entire survey. So you can cover a range of topics fairly easily and quickly, but you still have to be thoughtful about your participants' experience of that. And so surveys are really versatile. They can be used for a whole range of purposes, but they might not get really in-depth data. They might not cater to a wide range of experiences, particularly if you say, let's have a list of all of the potential sexual identities that one could have. That could be a very long list and you may not catch everybody. So thinking about how to cater to that range of experiences. They also may not be useful if you're trying to get data from a long recall period. So let's say, tell me about all the sex you've had in the last year. That may be really challenging for some people. And so getting accurate responses and honest responses may be a challenge with surveys. And there are a variety of implementation modalities. Here at Widener, we have access to Qualtrics, which I think is an amazing survey platform that's really intuitive in terms of building surveys and has a lot of flexibility. People do surveys over the phone, over text message, paper and pencil. I think people still do that sometimes. And so there are a whole range of ways in which you can implement surveys, which also increases their flexibility for us. So I'll do a quick summary of this information, and then next time we'll jump into experimental designs. So again, research design is really informed by the purpose, the stage, and the questions guiding the research, also ethical and practical concerns. And the design that we end up using really determines the kinds of conclusions we can make from our research findings. So being able to understand the advantages and disadvantages of different designs and the influence of that design on the conclusions that can be made is really critical to you as you begin consuming research and thinking about taking that research and using it in your own day-to-day practices. again, not to hit you over the head with this again, but each design has its advantages and disadvantages. So I think going back to that toolbox example that I gave early in the semester, being able to understand all of these different designs and their advantages and disadvantages will help you to go into that toolbox and decide what advantages you really need, what disadvantages are okay, that are not going to really be so detrimental to the research that you can't do it in the way that you laid out. But nothing is perfect, sadly. So if you have questions, if you have thoughts, post those under the general discussion forum. As I noted in my check-in last week, there is not anything due in this module, but you should be working on your topic statement and searching for literature and starting to make your way through the literature. If you have questions about that, please email me or drop into office hours. And I hope you have a great week.